Hi, I'm Varun Agarwal, Senior Associate Editor at ET CIO, and I welcome you all to our video series DX Café. Today we are talking about digital transformation that has swept everything in the past 1 year. The scale and momentum at which digital transformation efforts have been turned into reality in Indian organizations, especially in the past 1 year, has been a much awaited change in our country. To capture the essence of these unprecedented times, I would like to welcome Vikram Thaploo, who is the CEO of TeleHealth and PPP at Apollo Hospital. Welcome, Vikram.
Thank you.
Vikram, we've seen COVID disrupting many industries globally. Uh, you've been in an industry which has been disrupted quite a lot in itself. I mean, telemedicine and telehealth has been talked about for decades, but probably now is the time when it's actually taking off in a big way. So, how was your experience in the past 1 year, and what kind of challenges did you have to go through?
So, Varun, I think, as you rightly said, that we have been part of an industry, or specifically the division of industry, which has seen a rapid growth. At telehealth, we ourselves saw 19x growth for our teleconsults, which was definitely making sure that we had enough doctors onboarded, we had the technology to support it, servers to support it, bandwidth to support it. All that was kind of needed. What but what I would interestingly put forward that before this pandemic also, telehealth was doing pretty. Apollo Telehealth was doing good number of consults. So we had to scale up quickly. So that was the challenge. Also, we since I also am part of a network where we support government in doing the delivery of healthcare at different places. So in these 700 odd private public health centers, disruption came due to the COVID. Governments became difficult to deal with because all their focus was on COVID management. NCDs got the non-communicable diseases took a backbench because COVID became the primary for everybody. So these were different challenges. Scale up was a challenge, but I think we were able to do it.
Excellent. Now, vaccination is coming in. We've seen a lot of people getting really casual about the whole COVID scenario. A lot of people are assuming it's over, but we are also seeing the second wave coming in. Uh, but do you think the momentum of this rapid digitization would get impacted or get fizzled out as things gradually move to normal?
I don't think so. Reason for that is there are two parameters or a two pronged approach which was there. One is the natural digitalization, as we have been going through for last couple of decades, and the other is COVID induced digitalization. So I believe there might be little slack in it. It might dip a little bit, but it cannot be stopped anymore. So that's my personal take on it. Let's kind of go back and look at times when mobile phone adoption happened, when internet adoption happened. So when it started as premium, but the wave could not be stopped. Today we don't even think about what used to be internet 10 years back, when it was a premium commodity for all of us to use. Today we have internet in everything. So I think that's what is technology, how it is shaping up. And I think everybody understood. I give an example that nobody taught anybody how to use WhatsApp. So everybody learned on their own. Even before this COVID, everybody learned on their own, and they would add a feature, and next day everybody would know how to use it. They added status feature, and everybody knew how to use it. So technology will become so interesting and so intuitive that people will use it. So I think we are here to look at digital transformation. I think these initiatives are all in the direction, and everybody has understood that digitalization is good for business. And when people are able to connect the dots between digitalization and monetization, it stays.
So let's take the example of Apollo Hospitals. Like you talked about a lot of government partnerships that you've done. These equipment which are there in rural areas, it could be hard to actually understand how they work. How important then the whole intuitiveness of technology become for you when you look at these deployments?
See, I think necessity is the mother of invention, right? So when we deployed these devices in rural India, we have got presence. The device presence maybe in India about maybe 3-4 thousand centers which have one or the other device there, medical device. The platform which we used is a proprietary platform called MediIntegra, and it's been in vogue for last 20 years, and we have been developing and upgrading it since then. Today it has best of the architecture. It is on blockchain. AI is included in it. It's kind of having we call it DIL, the device integration layer. So that is connected to these devices. My team sitting here in the hub is able to real time monitor not only the activity of the device, but the quality parameters as well. So
Wow.
if someone has not calibrated the lab equipment in the morning, my audit team is able to call him and tell him that you have not calibrated the device today. So such is the real time connectivity we have created, and such is the and that all goes thanks to the necessity of monitoring quality with Apollo brand to carry. And when we kind of dispersed this across the nation, it became our primary job to uphold the value of brand Apollo. And I think that was the driver when we married technology with quality and with audits, and we were able to figure out this is how it happens. And if you look at telemedicine as a technology and the service delivery mechanism, this is more stringent. A physical doctor patient conversation is not recorded, but a virtual doctor patient conversation is recorded. You can dip into it 3 years down the line, also 5 years down the line, also, and look at what happened during that conversation. We dip into our conversations, we do audits, and the audit team is able to identify the training needs. Doctor is good at everything, but he is little too uh, short on time, or the doctor is doing great conversations, but probably he's not giving patient the right verbal advice on how to do what to do. So these identified training, I would say audit queries become training needs, and we then put those doctors into one training room for a particular type of concern we have with them. So I think doctors are also conscious, and I think doctors are enjoying it now. uh, Patients are also understanding it, and I have a different feedback also, that I figured out that rural Indians have better adaptability of technology unlike the urban, because urban have choice. So in rural India, we figured out that they happily adopt technology. They come to these digitalized sub centers, digitalized centers, and they are able to kind of take advantage of the technology.
That's an interesting insight, and in fact, I would agree with that. A lot of the facilities we see in telehealth uh, clinics in rural India are not available in some of the bigger cities as well. So that actually brings me to the next question, which is about going fully digitized. Now, the way hospitals are moving, the way healthcare is moving. Uh, how do you see the future of fully digitized industrial landscape, or specifically in your case, fully digitized hospitals? How far do you see this happening?
I think hospitals have been pretty advanced in the journey of digitalization. Every transaction is digitalized. Hospitals do have EMRs, or the hospital information systems, which are digital in nature. In this part of the world, our systems, since they were developed later, they are much more smarter. So you are able to do a lot of business intelligence on top of them. You are able to do a lot of patient centric approach. Like in Apollo also, we have our HIS, which is connected, which is all having, also a part of it is called PHR. So the data goes into patient health record, and patient is able to look at it. We are able to transfer patients from one hospital to another, from hospital in one part of the country to a clinic in another part of the country, through this PHR. So patients don't need to carry a physical document. It's all in their health record and it can be accessed from anywhere. So similarly, the landscape of healthcare is, I believe, is lot digitalized, and it's getting digitalized more and more with specifics which go up to genomics, and on the other side we are getting deeper into using technology driven genomics. Yeah, if you try and do it in physical settings, it's costly, but if you are using technology, you can rationalize the costs, and it can be given to larger population at a lesser cost. So I see digital healthcare is the future. Virtual hospitals will be futuristic, uh, and probably the tertiary care, quaternary care hospitals will only be used for interventions. The healthcare is going to home, it's going to their phones. So people will be able to manage their healthcare on their phones. They really don't need physical hospitals. And I think doctors have understood it, service providers have understood it, and the world is moving that way.
So the future is now, is what you'd say.
Yeah, I think so. This we are in the middle of the journey. We are in the transformation phase itself.
Excellent. Now, when it comes to digital transformation, we end up usually talking about large organizations, and the smaller ones, like India has hundreds of thousands of small and medium enterprises. Um, they usually struggle with this whole digital transformation journey that we're talking about. Now, what role can bodies like CDT and its partners play in enabling SMEs in adopting digital technologies and basically just transforming themselves, more importantly?
Yeah, I think great question. I have been part of this CDT, the CII initiative, and we have estimated that there are 60 million MSMEs across the country. So it becomes a responsibility of industry bodies to support these MSMEs in the process of digitalization. So what CDT started many things. One of them is the DX movement. The word movement itself is a mobilizer, right? So it says we create a movement. You should understand the importance of technology adoption, and you should understand that technology adoption is for business growth. MSMEs are interested more in business growth. So when you are able to convey, and that's what CDT has been doing uh, through webinars, through awareness sessions, through virtual sessions, we have been able to push a lot of sense into MSMEs and engaging them that the journey of digitalization is important for business growth. So these bodies are very, very important, specifically for MSMEs. And when these bodies are neutral, the faith is higher.
Absolutely. Now, there's this initiative from CDT called the DXL, which is one of its kind digital maturity assessment. How has your experience been, and what can other organizations gain from this index?
I think that's one of the great initiatives. The Excel has been, so it helps you gauge the digital maturity of your organization. Even if you are not part of a digitalization process at that day, at that minute. Industry experts have come together, put this together, and I believe every organization, including mine, should go through it. And I think we were one of the first to offer ourselves to this. And we should go through it, understand where we are on the digital maturity metrics. And tools like this are simple, yet very important for realization and roadmap making.
Thanks. Now, what are some of the other initiatives of the center that we can look forward to as we adapt to the new normal?
No, I think there are multiple initiatives where one of the interesting is DX catalog, which is being put together where a consumer and a provider are put together on a platform. You are able to meet. Ultimately, the this kind of a matchmaking is the best which can happen for industry and specifically for MSMEs. So I believe one of the best is DX catalog, and CDT is specifically being working on capacity building, which is also very important. It's not only tell what to do, it's also to help create who will do. So capacity building has also been a great initiative. Cyber security, as we saw a lot of cyber security breaches during the pandemic, and before that it was not too much in attention, but during the pandemic there have been many. So CDT puts a lot of focus on cyber security and helps MSMEs understand what and how to work around the cyber security. CDT knowledge repository, another initiative which is very important. All of this knowledge at one place which can be accessed. One of those great initiatives which are going to be part of our new normal. And then, as I said earlier, neutral body, unbiased body is what makes it so special.
Absolutely. Those sound like some really nice initiatives. And thank you so much for talking to us about these, and best of luck again, for realizing these initiatives in near future. Thank you so much for joining in, Vikram.
Thank you, Varun,
Lovely
for
talking to
giving
you.
this chance. Thank you, Varun. And thank you to CII-CDT for this. Thank you.